Okay, thank you for bearing with me. It's been a while since I facilitated this meeting. So, all right. So we've got a couple folks in the queue for open forum. I've got Katie Spade and then Dakota Hunter. Is there anyone else who'd like to be in open forum?
Hey, Erin, I can see Robin's hand raised.
Thank you. Okay, thank you, Brooke. Apologies. All right. Let's see. Okay, I'll put Robin in the queue also. Okay. All right, let's go ahead and start with Katie Spade. Katie?
Hi, Erin, this is Katie. Can you hear me okay?
Yes.
Lovely. Okay. And I apologize, everybody. I'm also having technical difficulties with my camera, so I'm going to keep working that, but you'll just see my name for now. So hi, everybody. My name is Katie Spade, and I'm with Consumer Direct for Colorado, or CDCO. We're the training and operations vendor here in Colorado. So welcome to 2023, everyone. Hope everybody's doing well. Two just really quick announcements today that I wanted just to give people a heads up on. One is we're actually fast approaching the annual FMS survey that goes out in the spring usually, that a lot of you are familiar with. So I wanted just to give you a heads up that that's coming probably in early April of this year. So the two things I wanted just to make you aware of that I hope you'll be super happy about is we're actually doing two things a little differently this year on the survey. And all of this has come from your feedback over the last couple of years, and we are working to integrate your feedback. So just the two things that are going to be some changes are we are going to add some questions around EVV. So that's been really vocal the last couple of years, which is great. We know those are super important. So we're working to add probably a couple questions about EVV. And then the second thing that is super exciting as well from your feedback is we're actually working for people to have an option of an electronic survey or a paper survey. So if you like a paper survey, don't worry, all you folks that love paper surveys, and I know there's some out there. So you can actually are going to be able to opt into either opt into the electronic, but if you don't want one or don't reply to that email blast that's coming up probably in March, you'll get a paper survey. So we just wanted another way and another avenue for people to take the survey and give their feedback. So we're going to actually have both options for a paper and an electronic this year. So just watch for an email blast about that. It probably won't go out until March, but just wanted to give everybody a heads up that that's coming. So that's one thing. And then the other quick thing is we've talked about this before in this forum, but we've actually been working for a really long time on a nice upgrade to the Attendant directory to look for caregivers and connect with caregivers. So that's something that's also on our website. So we've been working a long time and really hard on that. It's just going to be a really nice fresh look. Going to have nice, a lot better features to search and just a lot. It's just going to be a lot nicer to use and user friendly. So we're looking to do that February 1st. If you are a user on the directory, you're going to get an email here in the next week having you click on a link. And the only thing you're going to need to do is reset your password because it is a cut over to another platform. So just watch for that. You can certainly let us know, but watch for that. It should be very user friendly and how you get onto that new and improved platform. So that's it. Thank you very much, Erin.
Great. Thank you, Katie. Okay, next up, we've got Dakota Hunter. Dakota.
Hey, thanks, Erin. Hi, everyone. My name is Dakota. I am a program manager at Developmental Pathways, which is a case management agency. I just was asked to bring this to this group by some of our leadership who oversees our CDASS programming. So we're looking for a partnership between the department, Consumer Direct, the FMSs, other CMAs. We noticed there's, as part of case management redesign, just looking at what resources we have in our programs. And so we're looking to partner on making CDASS more accessible for bilingual families. We noticed there's a lack of resources for individuals who are Spanish speaking or have English as their second language. And so this is something I'm happy to bring out to the breakout room as well, but just wanted to throw this out there to either have it as one of our topics during this meeting or to create a subcommittee or something to look at revamping those. It's a pretty big project for just the CMA to work on, so that's why I wanted to bring it to this group. Again, I'm happy to go join the FMS breakout room today to talk about it more, but just again, wanting to throw that out there. So thank you.
Great, thank you, Dakota. And we appreciate you sharing this information. My team might be in touch to get some details from you, but thank you. Okay, next I've got Robin Bulldog. Robin, go ahead.
Oh, here we go. Hi. I actually had a question. So I've been working with someone who's transitioning out of Craig next week, in fact, and they were told by their case management agency that they had to be on agency care for 30 days before they could go on CDASS. And I remember that as an old rule, like during the pilot 20 years ago, but I didn't know that was still a rule. Is that still a rule?
Thanks for your question, Robin. Danny, you want to take that one?
That is not a rule under the CDASS program. They just need to be eligible for the waiver and be on the waiver, and then the services will be allocated as appropriate based on their individual needs, but they don't need to be in a facility for 30 days prior to enrolling on CDASS.
Oh, so that might be the confusion of the case manager. I couldn't figure out where it's coming from. No, they're not in a facility. They're not going in a facility, and they've already been approved for the waiver. So, you know, so maybe that's where the confusion is for the case manager. I couldn't figure out where that was coming from. Okay, that makes sense now. And now I'll send you guys a note officially saying, you know, there seems to be some confusion about eligibility for CDASS.
Thank you, Robin.
Okay.
Oh, great. It's always good to hear what is happening in the world out there. So thanks, Robin. Okay, I see a raised hand from Ethan. Ethan, go ahead.
Can you guys hear me okay? Hi, I'm Ethan Burden. I'm a 27-year-old male who lives in Evergreen, Colorado. I'm a CDASS participant. I've been on there since 2015. These are more policy questions, but I want to discuss how we can alter the Medicaid policy to advocate for health insurance for our caregivers, and then also changing up the EVV or the mobile application Time for Care, which is the application that CDASS users, CDASS caregivers use to clock in and clock out. Sometimes when my caregivers or attendants are not working shifts, the program for the application will create shifts for them without them even answering in shifts. So I want to understand if this is a technology issue or if this is a user issue, but more importantly, about the Medicaid waiver, because I understand that there's a contract with PPL, I think, but I want to understand how we can advocate for having in a waiver policy under the Medicaid contract to make health insurance easier for people to access, because I lose a lot of attendance because there's no healthcare offered for our employees. Thank you.
Great, thank you, Ethan, and welcome. I don't know if we've seen you before, but thanks for joining us. I'll just mention a couple things. First and foremost, we do have a place on our agenda where we talk about EVV, like system improvements and how things are going. That's later on in the agenda, but that might be a good place to bring up what your caregivers or your personal experience has been with the Time for Care app, as you mentioned. And we also have a breakout room that'll start at 2:35, where members and family members can join together and, you know, put brains together and hopefully come up with some great ideas. But thank you for those 2 points. All right, is there anyone else for open forum? Okay, not hearing any, and I'm just going to make a little quick check to see if John's here. He is not here yet. So, okay, Danny, do you mind switching to the PDPPC agenda topic request form? Okay, great, thank you. So this is my topic, and what we're doing is sharing with you an online form that members of the PDPPC can use to request agenda items. One thing that I've noticed in my long time with this meeting is that we've got a lot of great ideas that pop up and thoughts about talking about things next time. Oh, sorry, Danny, if you could go back real quick. Thank you. One of the difficult parts is we might say we want to talk about it next time, and then sometimes those topics don't get to the next meeting. And so typically what we've been doing is that our two co-chairs, Kurt Wolf and Kevin Smith, they would take your topics and then bring them up at our planning meeting, which happens the first Wednesday of each month. You know, that being said, sometimes we don't get requests, so those items aren't brought up. So we've developed a form that anyone can fill out, and Danny is sharing it here on the screen. We'll put the link in the chat, and then it is linked on our department website. But it's some basic information about what you'd like to see at a meeting. So Danny, if you don't mind going down a little bit, we need a name, an email address, and a phone number. And then we do have a space for you to put what your topic is. And then Danny, if you could move down a little bit more. You can say, you know, I want to be the speaker of the topic, or I think I want someone else. So you can state what you want there. And then if you're not sure who would be the speaker, you can select, like, I want a vendor to talk about this, or maybe department staff. We will likely contact you if you have something that you want to talk about where we're not sure who would handle that. And then we also have some information about, you know, what the topic is. Are you wanting to make a recommendation? Do you want to have a group discussion? Do you want to make an announcement? And then following this form, when you submit it, there will be some follow-up where our planning committee, which is, again, consists of the department staff who helps with setting up the meeting and running the Zoom call, and the PDPPC co-chairs. So what we aim to do with this is really to make sure that members can contribute topics, and that we follow through with those recommendations to have a topic. And then also that whoever's presenting or wants to speak has enough time to prepare and is supported in preparing that item for the next meeting. So I know this is a lot. We do have this form, again, live. It's linked on our website, but I'd like, ooh, thank you. Thank you, Danny. So Danny right now is showing our PDPPC website, and you can see we've got the topic request form here, as well as contact information for both of our co-chairs, and then John Barry. So this has been a really high level overview, but do we have any questions, comments, concerns? Anybody who'd like to speak on this matter? Okay, I'm not hearing anybody, but thank you for allowing me to show this to you. I hope that you'll use it. And again, this is really meant to help keep us on track and make sure we don't miss anything that people want to talk about. All right, Danny, I think we can go back to the agenda. Okay, let's see here. So looking at a quick time check, we're running ahead of schedule a little bit today. So it's about 1:21. We're going to move ahead to the Community First Choice, or CFC updates. Do we have the CFC team here to do this update?
Yes. Hi, Erin. It's Eileen.
Hi, Eileen. Okay, Eileen, on with you.
Perfect. Thank you, Erin. So my name is Eileen Saunders. I'm a policy advisor on the Community First Choice team. And I apologize, my video is a little dark right now, so I'm sorry if you can't see me very well. For some reason, the light is out in my office, but we'll figure that out later. Anyway, I am here today to provide a brief overview of Community First Choice for those of you who may be unfamiliar with the program, as well as introduce the CFC and the CDASS work group. Okay, so Community First Choice, or CFC for short, is a Medicaid state option that was enacted by the Affordable Care Act in 2011. So it's not a mandatory program, but it is a program that states can choose to pursue. And the goal of Community First Choice is to really make home and community-based services accessible to more Medicaid members. It does this by allowing states to take a certain set of those core home and community-based attendant services, such as personal care or homemaker, and pull them out of the waiver programs where they typically onto CFC, where it lives, to expand their participant-directed care options. So in Colorado,
You're cutting in and out. We're losing audio.
Eileen, I don't know if you can hear us or not, but you are frozen. Okay, we might need Eileen to maybe exit out and come back, or try to turn off camera. We're going to give her a minute to do that. At least she doesn't have a funny face right now. Okay, let's see. I think we'll see if she'll come back in just a moment. Thank you for bearing with us. Yay, technology. Oh, John Barry. Hi, John Barry. Are you with us?
I am. Can you hear me?
Yes.
Oh, good. Sorry about that. Had a very unusual internet going out here, which is unusual, and bad timing. I will jump in or not jump in. Are we waiting for Eileen?
We are waiting for Eileen. I think we could maybe do another quick check of attendance. Anybody who was not able to fill out the online link.
Oh, yes, or anyone who's just on the phone. You can unmute your phone by pressing *6 if you are on the phone only, or if you had trouble with the link. Anybody? Or if you had trouble with the link, you can type your name in the chat as well. We had some people who were phone only people already, Erin, give their names.
Yep,
Super.
I've got 4 folks, so I'll pass those to you in a bit.
No problem. You know, while we're on it, I just want to give a shout out to Robin Stevens, who has picked up the gauntlet for the attendance form, and so far, in my view, is doing a super job, and she knows the Excel way better than I do. So, a detail person, thank you, Robin, if you're with us. Let's see, new messages in the chat. I'm just getting in the swing of things here. Let's see. No, that was staff. Okay. Should we move forward and come back to Eileen?
I am back on, actually. I'm so sorry about that, everyone. My internet just dropped. I apologize.
Oh, there's a lot of that going around. Please continue. Thanks.
Okay, great. I'm so sorry again about that. Just a weird home day, the electricity and the Wi-Fi. So anyway, so I believe I was just speaking about how we are moving IHSS and CDASS over into CFC, along with kind of that core set of home and community-based attendance services. And that's very exciting because you no longer will need to be on a specific waiver in order to access either IHSS or CDASS. You also can be eligible for CFC on the state plan as long as you meet institutional level of care. And that level of care is like a nursing facility level of care, hospital level of care, intermediate care facility level of care. So if you do meet those eligibility requirements, you will also be eligible for CFC and can access in-home support services and CDASS that way. So because we are moving CDASS over into CFC, there are some policy changes that we will need to kind of work through with you all, with our members and our stakeholders, in order to make CFC and CDASS compatible. There are just some regulations with CFC that we need to kind of address as we move forward with bringing CDASS over. So in order to do that, we have created the CFC and CDASS work group. And this work group will start in 2 weeks on February 9th. And the purpose of this work group is really to kind of dive into these policy issues with you. We need your help to kind of work through each one of these policy changes. We need your help, your expertise, your input, and your feedback to really make the right changes that we need. We also have a relatively short timeline to do that. So we are meeting twice a month, the month of February, March, and April, and then once a month in May and in June. So it might seem like a lot of meetings, but we wanted to make sure that we appropriate the correct amount of time to really give these issues, the time that we need to come up with the solutions together. So if you are interested in joining us, we do have an interest form that I believe Christine will send out either at the end of this meeting or in the chat. In this interest form, we do ask that you fill it out if you would like to come to these meetings. The meeting dates and the topics are all on that form as well. If you cannot make it to any of the meetings, but you are still interested in what we discuss, we will always report back to PDPPC and our CFC council meetings that will still happen every month. Okay, and I think that about covers it. So does anyone have any questions?
So this is John. If anyone does have a comment or question, you can give me your name verbally or in the chat right now. We'll set up a speaker's queue. *6 to unmute your phone. You can also raise your hand in the webinar by going to the reactions button on the bottom of the screen, clicking that, and it will show you an icon for or a box for raising your hand. Anybody? The link to the interest form is in there twice, so you can only you only have to use it once. But anyway, it's there. Thank you, Christine. Anybody? Questions, comments?
Renee.
Renee, please go ahead. Thank you.
Can you tell us what kind of changes need to be addressed?
Yes, thank you, Renee, for that question. So some of the changes that we will be discussing in the work group are, for example, children will be able to utilize CDASS, which has not been the case up until now. So that's an example where we want to make sure we're talking through and thinking through all the implications for that population utilizing CDASS. Another change will be that members who are in unstable health will also now be able to access CDASS. Currently, there is that stable health rule that we have for CDASS, and so that's another policy change that we want to discuss with you. So those are a few of the key examples.
Okay, thank you, Eileen and Renee. Thanks for that. Anyone else? There is a question in the chat from Nicole. Have the meeting invites been sent out for these meetings? Great question.
That's a great question. So we will be sending out the meeting invites. I believe maybe at the end of this week or next week. We want to make sure we give everyone time to fill out that interest form.
Okay, thank you. So that is filling out the interest form as a way to get a hold of the meeting invite information, just to be clear. This is not
Right.
anything that's our stakeholder calendar, folks, the OCL calendar. So the way to get it is to get the form. And if for some reason you come away from this meeting and don't have the link we just put, we have posted it in announcements in our OCL newsletters. There's one that has gone out already, and I believe the one that's going to be going out today actually also will have it in. We ran another reminder. So, and if you folks, if anyone doesn't get those OCL newsletters, they're otherwise known by some people as the John Barry newsletters, God knows why, but please let me know, and we can get you the information about signing up to receive those.
Thank you, John.
Okay.
Yes, that's perfect. And the meetings will be from 1 to 2:30, or the first meeting will be from 1 to 2:30 on February 9th, which is a Thursday.
Yeah. Right. You know, as long as I'm on the speakers platform here, I'll just say that there is also a community first choice specific communications list in Constant Contact. And if you're interested in getting stuff just about CFC, let me know. And I can get you the link to get to that place to sign up for that list. Any other questions or comments? Let's
Hi, John.
see.
This is Erin.
any-
I have
Oh,
my
go
hand
ahead.
raised, but the hand raising today is a little funky. So I'll just put a plug in that this is really, really important stuff for anybody interested in self-direction. It is really specific to CDASS, but anybody can join the meetings, and we really like to have PDPPC representation. And I'll just say this, like, you know, I realize this is a pretty large commitment to join 1 to 2 meetings for the next 6 months, every month. That being said, a lot of these decisions that need to be made need to be kind of finalized by late summer, early fall. And so in order to do that, we've got to get this kind of work group moving. And the other thing I'll mention is if you know someone who might be a great person to join this work group, like maybe someone who works with kids or has familiarity with people who will have access to CDASS and CFC, please share the information with them. You know, I think there's a lot of really good topics that we need to discuss, but we want to make sure that PDPPC folks and our stakeholders are really leading that process and participating in, you know, what the future of CDASS looks like. So thank you all for hearing us. And Eileen, thanks for coming to this meeting and sharing the information. The interest form, again, it's like optional. We're just trying to gauge and gather a really solid group of people who bring different perspectives. The meeting dates I plugged into the chat, but otherwise, we hope to see you there in a couple weeks.
David in the queue.
Okay, David, I have your name down. Anyone else with a question or comment? We'll line up the speakers queue. I'm looking in the chat, looking for hands raised. No one else? Okay, David, go ahead, please.
So these are great for everybody that has internet access, but how about those? We have a number of PDPPC members who are telephone only. How are they going to be able to sign up for this this little subcommittee? It's a couple of times I've heard today, oh, go online, you sign up for this, you go online and sign up for that. Let's not forget those members that have been coming to PDPPC for, in many cases, for 10, 15 years, who only have access via telephone. So let's not forget about them, okay?
Thank you, David. That's a really great point. For those of you who only have telephone access, you can call Jordan Larson, who is the same phone number. He's the same policy advisor who you can call on our Community First Choice Council meetings. And he will make sure that you get all of the meeting information. And I will put his number into the chat right now. If you give me just 1 minute, I'll grab that.
Okay, just so you know, putting it in the chat doesn't help somebody who doesn't have internet access.
Right, right. I will speak that out loud as well.
You can do that. I will also just add, so there's more than one option. Folks in this meeting know me, they know of me, and my name is John Barry, and you can call me also, not in addition to or otherwise, but just as one other option. 303-866-3173, 303-866-3173. Just let me know you want to get the invites for the meeting, get that information. I will relay it to their staff, but also the direct number for Jordan would be good as well. And then you can circle back in this meeting. We'll have other points,
if that works.
Oh, you do? Go ahead. Thank you.
Yeah.
Okay, sure.
It is 303-866-3580.
One more time, Eileen.
303-866-3580. And I'll put that in the chat just so that you have it, John.
Yep. And David, I want to thank you for bringing that up. Absolutely. So, okay. Anything else, Eileen?
No, I think that's it. Thank you so much.
Erin, anything else on this topic? You had a comment before. Anything you want to say before we move forward?
Nope. Thank you. Hope to see you all there. Exciting times are ahead.
Okay. Folks, forgive me. I came in late. As you heard before, perhaps I'm a little discombobulated. I'm getting in the groove here. If you can put up the agenda, Jessica, or whoever's covering the screen.
John, I see the agenda on the screen. I don't know if it's, do you see it now?
You do. Uh-oh. See? There's me being discombobulated. Case in point. Okay, so we're moving forward to the attendant in the hospital recommendation, the department response, and we are still ahead of schedule. Excellent. Erin?
Thank you. I'm actually going to pass it along to Danny, but just to summarize, we didn't have a meeting in December, and in November, we received a recommendation from the PDPPC to look at allowing CDASS and IHSS attendants to be paid to complete care when the member is in the hospital. So Danny, I'm going to hand it over to you.
Thank you, Erin. So thanks for providing that context. Just to reiterate, we received that recommendation on November 16th. We have been working very diligently to research all possibilities with this. This recommendation is highly complex and has required collaboration across multiple divisions. So unfortunately, we do not have a formal written response for everybody today. We want to make sure that we can provide comprehensive information that is well thought out and accurate before we share with you all. And because of the complexity of this request, it is taking us a little bit of time. We do anticipate we will have a response for the group in, I would say, the coming weeks. I think we're very close. But that is where we currently sit right now with the policy recommendation to allow attendant care while members are in the hospital. Robin, I see your hand in the queue. Are there any other questions or anyone else who would like to speak right now? Okay, Robin, go ahead.
I guess I'm just really curious about what I would think one of the key the key entities would be hospitals. And I'm just curious if you're getting pushback from them. I guess my thought was the word liability is being thrown out there. You smiled, Danielle. I could see you do that.
I'm looking over at you and I'm trying to be positive, and I see Erin's smile too, and I'm just
I'm sure the word liability came up on a regular basis. And just so I'm going to throw out the liability question. So I was talking to somebody about this morning, as our employees, so under CDASS, as our employees, the liability would fall on the employer, which would be the consumer. IHSS, it gets messy. And there's been a lot of discussions in various groups that I've sent information out. And I know you've got some great testimony from people talking about the impact on their lives of not being able to do this and the medical complications, and you'll be getting more, right? So, and the same discussion comes up every time we talk about consumer direction is liability. Even just recently, the right to repair bill, and what was the, why did we not have the right to repair wheelchairs? It was because of liability. And none of that is real. So that's why I get frustrated when they throw out liability. So, my husband fixes his wheelchair, the liability's on him because he fixed it, not on the manufacturer. And to me, it's the same argument. If he hires an attendant in the hospital to work with him, who's his employee, that's his liability. So I want to throw that argument out in case you guys haven't thought of it. I'm sure you have, but I just want to, it just drives me crazy, this whole false liability discussion that happens with bureaucracy. And as far as I've been told, under the CARE Act, they have to allow attendance in the hospital. So that's not even a question. The only question here is who pays for it. And we've been asked multiple times in hospital settings to hire attendants for my husband. That if we want his personal care taken care of, the hospital asks us to hire somebody. So none of this is about whether they can or can't come in and provide care. They can, and it's the law. The issue is the only issue is who pays for it. So that's my comments.
Thank you for your comments, Robin. And I also just want to thank you for the recommendation that you worked with your committee to put together. I think in that recommendation, and just now you provided some very thoughtful arguments and information and justification. And I just want to assure you that this has all been looked into. As I did say, because of the complexity, it's not necessarily just a policy that lives with the participant directed programs team.
Right.
It's clearly, with hospital teams and state statute and all federal.
And hospitals love to control. I mean, they're trained to be in total control. And here's the other thing I'll throw up is, here's where I'm at. My husband gets hurt in the hospital again because they refuse to provide care that he needs, personal care he needs. I guarantee you they will be liable. How's that?
Yeah.
And we will enforce it. So.
Thank you, Robin. I really appreciate your personal testimony and just all of the information you've shared with our group. And I hope that we can have a well thought out and comprehensive.
Yeah, I hope so too. And if you could include some of us in the discussion, I'll be more polite. That may be helpful too, to hear from us about, what happens in the hospital and what it is we're asking. So, I realize there are some meetings that can't include us, but if you could figure out a way to include us, and maybe put a human face on the issue, that might be helpful too.
Thank you, Robin.
Okay, this is John. Is there anyone else who has a question or comment about this topic, which is the department response to that recommendation? You can raise your hand in the webinar. You can type your name in the chat. You can unmute your phone, *6. Give me your name. Okay, seeing none, hearing none. Danny, I think we're back to you.
That works. Well, unfortunately, you all get a little bit more of me as the next topic I'll be presenting on as well. We'll be talking about the utilization management vendor and all things that. If you would give me just a brief moment to pull up just a visual aid, just to kind of keep the conversation on track. We'll get that pulled up, and then I'll continue with that part of the conversation.
Danny, this is John. May I check in with you? And I know I'm late to the meeting. Was the background check item covered already?
Oh,
That is next
geez.
on-
Nope. I skipped right over that. That gets to go to Jessica, and then we'll come back to me. Thank you, John.
Okay, no
Thanks,
problem.
John. Thanks, Danny. This might help so Danny can prep the slides she has prepared for UREM. So hi, everyone. This is Jessica. Again, contract specialist for participant-directed programs. I want to provide an update on the progress of changing our CDASS background check policies and processes. For those of you who are new to PDPPC or just need a quick reminder of what I'm talking about, the department has been working with stakeholders for quite some time to update what crimes prevent an individual from initially being hired as an attendant, building out an exception process to provide employers some choice in that hiring process, developing resources, and a few other operational steps on the department side. A formal recommendation was created and submitted by stakeholders last year, and we had a PDPPC vote on it. It was voted in the affirmative. That formal recommendation and the department's formal response to the recommendation is on the PDPPC webpage, so anyone who's interested in taking a look at it can go there for it. John also provided it, I believe in the July or August, around that timeframe, materials that he sends out. In terms of the update for today, the department followed the timeline that we outlined in our formal response to implement these changes, and that included incorporating language about the changes into our waivers. From this waiver work we got really substantial feedback from CMS. CMS, the Centers for Medicare and Medicaid Services. And they had determined that the new high-risk crimes list and the process that we were changing needed some further changes in order for our waivers to be approved. And so we worked very closely with them for several weeks to incorporate their feedback, really trying to, of course, meet their requirements, because that was incredibly important and required, necessary, as well as uphold as much of the changes that you all communicated were important to you based on the really helpful feedback last year. So what this has meant is that we, as the department, had to make changes to the high crimes list and to incorporate some parameters around those crimes, build out the safety plan and that process related to safety planning, as well as oversight, and then put an extra emphasis on the resources that we're working with Consumer Direct to develop and make available to CDASS employers as an additional level of support so they can better understand the background check process, what those reports mean when they review those for hiring individuals. So we are still working on incorporating these adjustments into the various places they have to live. And so I'm not able to provide really any detail today, but we're on track, and it will be the case that we should be able to present this information thoroughly and with a lot of detail next month during our scheduled PDPPC meeting. So just to reiterate, we did have to make some changes to the crimes list, and part of the process, really striking that balance between supporting member choice and ensuring that the department protects the health and safety of Medicaid members. So that is my update. I'm available for questions or comments.
Thanks, Jessica. So this is John. I see one person in the queue already. We'll get to you, Marcia. Thanks. Anyone else for the queue? You can raise your hand. You can unmute your phone, *6, give me your name, or type your name in the chat. Anyone else other than Marcia? Okay, we'll start, and feel free to type your name in. Marcia, go ahead.
Thank you, John. I recently ran a background check on an attendant, and it came back with a kidnapping charge. And on the forms that I have currently about the new changes to the background check, it does not list kidnapping on there, but it lists abduction. And I don't know if that's a change that's been made or somebody's looking at that, but I actually contacted a colleague in the court system to ask if that kidnapping and abduction was the same thing, because there's nothing about kidnapping on there. And I was told that Colorado, or kidnapping is a chargeable offense in Colorado, but abduction is not. And so I know that caregivers come from other states, abduction might be on their background, but I'd also like to see maybe kidnapping covered in that area as well.
Thank you, Marcia. This is great feedback. We absolutely love to hear personal experiences with reviewing those background check reports and getting this kind of feedback. I'll definitely take a look at the materials that have been supplied up to now, because as I recall the crimes list that we updated from the work from last year, I believe we had abduction and kidnapping put together in the same category. So if that's not the case, we'll definitely add that to make sure it's addressed as we push out the final list and materials. So we address that. Thank you so much.
Thank you, Jessica.
Thanks, Marcia. Anyone else with a question or comment for Jessica on this topic? Okay, hearing nothing more, seeing nothing more. Thank you, Jessica. And this takes us back to Danny, the utilization review, utilization management stats. Danny?
All righty. Thank you for bearing with me as I fumbled through the agenda, but we are now back to utilization review, utilization management subcommittee reporting, where we'll be talking a little bit about the HCBS utilization review, utilization management. I'll frequently be referring to that as URUM. It's a little bit less of a mouthful. All right. Okay. So as we get started, I do want to remind everybody of our mission at HCWAP. And our mission is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Why am I sharing this with you? Because the URUM reviews align with this mission statement, and the purpose of these reviews are to ensure that home and community-based services members who receive health maintenance activities are receiving the right services at the right time for the right person. For context for this group, if you're new or unfamiliar with utilization management, our utilization management vendor for home and community-based services is Telegen, who began completing reviews for the department March of 2021. I think it would be helpful today to quickly touch on some trends that we have had over the past quarter. So this would be including let me think, July, August, and September. So some stats or trends that we've noticed for that quarter. One of the concerns we've heard from the stakeholder community is that reviews are not getting completed in time, and members are at risk of gaps in services as a result. We recently dug into the submission timelines for reviews and learned that on average, reviews are submitted to Telegen 16 days before the certification start date. While this does allow time for Telegen to complete the review before services are set to start, it does not create much of a buffer if Telegen requires additional information to process the review. Our goal at the department is for reviews to be submitted between 30 and 45 days prior to the certification start date. This timeline would coincide with the annual recertification assessment and would allow case managers and members ample time to provide additional information to Telegen if necessary. Another trend we're seeing with reviews right now is just the general understanding of the review process by our case management teams. And so we're going to just go into a little bit of how we're working to combat some of these concerns and some of the steps the department is taking to address. All right, so first I would like to start with one of the items that the department developed to improve the URUM process, which is our URUM webpage. This webpage houses all things home and community-based services utilization management reviews. So on this webpage, individuals can find the different reviews that are completed by Telegen and get more information about the reviews that Telegen completes. The website provides information for case managers about upcoming Telegen office hours, and the webpage provides resources that the department and Telegen have created to assist case managers with submitting utilization management reviews. We are also initiating a URUM process improvement work group for case managers. I'm really excited about this. During this work group, we will be discussing ways to improve the health maintenance activities documentation guide. As we've heard that that's a helpful resource for case managers, but we want to make that better and easier to understand. And we'll also be talking about best practices for documenting health maintenance activities within the assessment. So this is an opportunity for our case managers who are completing their reviews and submitting reviews to Telegen to provide input on ways that we can actually make this process better, which will hopefully help them, and as a result, help all of our members who receive these utilization management reviews. And I think we are going to get some pretty helpful feedback, and I'm really excited to see what we can do with that and ways that we can make this review process smoother moving forward. Our unit, the Participant Directed Programs unit, is also collaborating with the Case Management unit to provide technical assistance to case management agencies to improve the submission timeline for the utilization management reviews. The goal is to submit these reviews 30 to 45 days prior to the certification start date, so that members and case managers have time to provide additional information to Telegen if that information is needed. So we are working on providing technical assistance, and I hope to have more information on how we're doing that in the coming months, but that is a process that we have just recently started. In addition, Telegen is continuing to provide quarterly office hours to our case managers to offer technical assistance surrounding utilization management reviews. These office hours tend to be pretty well attended, as we typically see over 100 case managers from various case management agencies in attendance each quarter. During these office hours, the department and Telegen bring topics that we notice case managers are struggling with and provide just additional information and technical assistance. And we also have a huge chunk of the meeting, approximately 45 minutes usually each quarter, open for just question and answer. And this is an opportunity for case managers to ask questions about reviews or how to submit reviews or any of the general questions they could have about utilization management. And then finally, the department is working with Telegen to improve our reporting so that we have more relevant data to work with and to present. A couple of the areas that we're focusing on is to have reports that outline the number of cases that were either reopened or reconsidered following a denial or partial denial. Another report that we're working towards is a report that outlines what services were requested and ultimately approved by Telegen. And then after that, in part of the same review, it would tell us if health maintenance activities were denied, did other services increase? So we're hoping to get all of the prior authorization data and merge it with Telegen's data for reviews to get a full picture of what's happening for these individuals, so then we can figure out where we really need to work to make sure our members are supported. This report will use data from both Telegen's system and the department's prior authorization system. And it's a big hunk of a report, and it's something that's been in the works for about 7 months. And I think we're hopefully getting close to having that be usable. So more information to come on that. Go to the next slide. So that's all that I have to present for you today. The department aims to provide useful information to our stakeholders. We're working with our vendor to collect and track data that's more comprehensive. But in order to provide the most helpful information to you, I want to know what you're interested in and what you would like to know. I think I have a pulse of what would be helpful, and so that's what I've been working towards. But the best way to meet our stakeholders' needs is to hear from you what you would like to see from us and what you'd like to know about utilization management. So if you do have suggestions for data you would like to be shared, or topics related to utilization management that you'd like to be shared during our next quarterly presentation with PDPPC, please email the PDP team at hicpuff_pdp@state.co.us, or you can call me, Danny Comstock, and my phone number is 303-866-6138. And again, my phone number is 303-866-6138. And I will also make sure this information is in the chat. Oh, thank you, Emily. All right. So that's what I have. Do we have any questions or comments or concerns about this presentation today?
Thanks, Danny. This is John. So if you have a response, question, comment, you can raise your hand in the webinar, type your name in the chat, or unmute your phone. Give me your name right now. Anyone? Looks like nothing right now, Danny.
Cool. Well, open for feedback whenever it comes. So thank you all for your time today.
Okay, thank you, Danny. So let's do a time check-in here. We are ahead of time by about 25 minutes. And I believe that we had a tentative plan that we might accomplish the EVV improvements item if we did have time before the break. And Erin, I believe it does look like we have time.
Yeah, I think I see Jillian is here who does EVV. So I would suggest we move that up if possible.
Okay. Let's see. Let me, so we are going to be covering item number 12, Roman numeral 12 on the agenda, which otherwise would have started at 3. So let me, and with the internet trouble I had, Erin, I just will say to you that the introduction we had to this, I lost on my screen, so I'm going to do it. And if I miss any part of it, you please jump in. So we had a plan that we had put out to the group, and also in particular to the 2 very active stakeholders, Kelly and Ray Michael, who have been involved in this, that we would we are going to be taking 20, and if we need a few more minutes, possibly up to 25 minutes for this item. We have 5 sub-items for this topic. Each one of those will get 4 to 5 minutes. I will do a speaker's cue for each one. And, oh gosh, Erin, am I missing anything?
No, I think we're good. So outside of, we've got these 5 questions. The first 2 are really for CDASS participants to share how they're doing, and John will be managing the queue. So thanks.
Okay, so I have my clock with me here as I'm doing this. So let's start with item number 1, which is what is going well? And let me ask for names for the queue. Is there anyone who would like to make a comment on what they see going well, or a question about that, I guess? Also, anyone, you can, again, raise your hand in the webinar. You can type your name in the chat. You can unmute your phone right now and give me your name. What is going well with EVV Improvements, or EVV? And this is for CDASS participants only for the moment. Just so we make sure that we cover this one more time. If you do want to make a comment, okay, we have Robin in the queue, be right with you. Anyone else? Because what I want to do is budget the time that we have, these few minutes for each item. Okay. Robin Bulldog, please go ahead.
Sorry, I think we're all struggling with what's going well. So, if I look at it from a national perspective and what I'm hearing from other states, what's going well is the fact that we have waived EVV for live-ins. Not all states have done that, and that's huge. The other thing that's going well is that we have a backup system of using the online portal. That's going well, and I'm somewhat curious about how often that's being used. Some states don't have any backup system, and that's incredibly problematic. And some states have limited the amount of times you can use a backup system like that. So that's what's going well. We have a backup system, and we've waived we've waived live-in attendance. So the actual apps themselves, I'll leave that for the next question.
Okay. All right, thank you, Robin. So that does move us to the next question, and it sounds like, Robin, you're already in the queue for that, perhaps. Anyone else would like to speak to what is not going well? And questions 1 and 2 are equal, I assure you, equal interest to the department. The way things improve is when we find out what's not going well. So participants only, is there anyone other than Robin who might, in addition to Robin, I should say, who might have a comment about this? You can raise your hand in the webinar, type your name in the chat, unmute your phone by pressing *6, giving me your name. Okay. Robin, sounds like you had more you wanted to say. Do you want to start?
Always takes a minute to find the buttons. We're using the Palco app, or my husband's attendants are using the Palco app. And yes, there are times when it does not work. And again, the backup system works well as a backup to it. But it's incredibly frustrating when it doesn't work, and not all the attendants seem to realize it's perfectly okay to use the online portal, even though we say that on a regular basis. It's okay. And so we do see sometimes where people, even though they clock out, the app doesn't clock out. There are times when people can't clock in. Usually if we're in a place where there's not really good Wi-Fi, if our Wi-Fi is down, even though supposedly the apps are supposed to capture the information and then download it once you hit Wi-Fi, but that doesn't seem to happen. And the app is, everybody here has gotten used to it, but the app I think could be made better in that there instead of typing in my husband's name and ID each time, there could just be a drop-down menu, and that would make it a lot easier. So those are the things that we continue to ask for that doesn't seem to be fixed, and that is really just making the app a little more user-friendly.
Okay, thank you, Robin, very much. Anyone else for item number 2? What is not going well regarding EVV? Again, you can raise your hand in the webinar, you can type your name in the chat, you can unmute your phone to give me your name. Okay. As always, we're available to be reached out to by email, phone call, etc. outside of this meeting. We'll move to item number 3. I will place Jessica for the
Oh, I think
department in
Kelly
the
Tobin
queue.
had something to say. She's having technical difficulties.
Oh, I didn't see that. I missed it. If I missed it, hold on. I beg your
It's
pardon.
in the chat.
Oh, okay. Kelly, please go ahead. She's dittoing. Kelly, apologies for the trouble you're having. If you want to speak up at this point. We do also obviously have open forum number 2, Kelly, if you wanted to use a minute or 2 there to speak, if the problem works itself out by then. I will be keeping an eye on that, Kelly. I am going to move us forward in the meantime. Item number 3, Jessica, I have you in the queue, and FMSs. Is there anyone who wants to put themselves in the queue for item number 3?
Yes, John,
let-
Jessica here.
Let's see if there's any FMSs who are going to speak, or are we assuming they'll all speak, Jessica? For
It
item
is the
number 3?
expectation that each of the FMSs contribute to 3 through
Okay.
5. Thank you.
Very good. So I'll stop. Please go ahead then.
Thanks. So in terms of number 3, what improvements have been pursued? The department has worked with both PALCO and PPL to identify EVV app functionality that we learned combined with some member actions contributed to some issues, namely the ability to future date timesheets and then have span shifts extend for up to 72 hours. So we worked on those with PALCO and PPL, and I can provide more in the next item. The other improvement that has been pursued is to really continue seeking out feedback from participants and keeping those channels for feedback open to individuals. We were able to complete a couple listening sessions in November, which I believe over 8,000 people were invited to. So those are the 2 main improvements we've pursued since the last update.
Okay, thank you, Jessica. So just randomly, I'll start us with PALCO for this item number 3. Anyone there from PALCO?
Hi, John, it's Victoria from PALCO. I'll just echo what Jessica mentioned. We've been working closely with the department to engage with stakeholders and kind of review their feedback and take that to the vendor that we subcontract with, which is Fiserv, which is the group that manages and provides that Authenticare app and the telephony, the call-in version of the EVV service. So we've taken feedback to them repeatedly, and so we continue to work with them to work through any issues that folks present to us as they're trying to use the Authenticare mobile app. And also to Jessica's point, during some of the EVV compliance stuff that we've been looking into with the department, there does appear to be the ability for folks to future date their timesheets in PALCO Connect. And so we're working to kind of shut that down, because that has proven problematic for some folks in terms of EVV compliance. So that's all I got.
Okay, thank you. Thank you very much, Victoria. So PPL?
hopefully, hi, good afternoon. Hopefully I'm off mute here. Good afternoon, everybody. I hope everybody had a good new year. I just wanted to give a few updates for our app at PPL and what's been going good there. So back in September, we had a similar, it sounds like, bug to what Palco had of people being able to select future dates for manual entries. We actually fixed that bug in our September app update. We also did, we fixed so that it's more visible what status timesheets are in when we're processing payroll, because that was another issue. People couldn't see like the status of their timesheets. We made the offline mode messaging a little more clear in the app. So it's a little more apparent when it's in offline mode, or if like we're having system maintenance or something like that. It's just a little easier to tell what's going on, like their system maintenance, offline mode is available. And then also our in-processing shifts now that show up can be submitted or deleted. So please look out for these updates. We're going to be putting them in our newsletter that we're doing, our quarterly newsletter. We'll be having a section about this, and we still have our EVV help desk. So if you need any help, please contact the EVV help desk. We're going to drop it in the chat. And then I can read it out if there's time. If not, we can read it out in the next open forum. Thank you.
Thank you very much, Rebecca. Okay, so we're on to item 4. What has been accomplished? Jessica?
Yes, thanks, John. So in terms of what's been accomplished is working, as I mentioned in the last item, with Palco and PPL to look at some of that functionality and make some necessary changes as it relates to the listening sessions that I mentioned. We had 11 people attend. Some individuals attended both days. And there was really good participation and some helpful feedback from that. I'll say there wasn't a significant amount of new information that had been shared, but again, we are always available to hear directly from you, your challenges with the EVV technologies that our vendors use, and do our best to troubleshoot with you and with them to find solutions. I'll just also add a EVV outline was included in the PDPPC materials. I won't go over that, but please reference the email that John sent out for that document if you're interested in learning a little bit more. I'll just highlight that from it, CDASS EVV compliance remains at 99+%. So we're still doing really good as a state in terms of our EVV compliance and the federal mandate. And that's with a lot of hard work from Jillian Estes. I will shout her out because she works very hard to make sure that that's the case. So thank you, Jillian.
Okay, thank you, Jessica. So we will change it up. We'll start with PPL this time. And Rebecca, if there's anything that you didn't cover in your last segment about what's been accomplished, please go ahead. Tell you what, we will come back and see if she is with us in a minute. Victoria, Palco, anything that you didn't cover so far about what's been accomplished?
Yes, so based on stakeholder feedback that we've received over the last few months, we have updated the mobile app user guide, the EVV mobile app user guide. It's it's been reposted to our website. Some of the updates there come directly from stakeholder feedback related to I'm thinking what you see when you have logged in and the app sort of times out while you're doing your shift, and then you come back and log back into the app, and the landing page you land on, there's some screenshots there that prompt that checkout process to show you the open shifts that you might see when you log back in. So there's been an additional screenshot added for that. We've added some language around the frontier mode, which is something Robin was mentioning earlier when the app is offline. So we've added screenshots to show what that looks like, and some language about how frequently or how soon you would need to connect to Wi-Fi for those shifts to move over from the Authenticare database or server to Palco Connect. And we also added some language and some screenshots on a calendar view that some folks may not have known existed, but in the Authenticare mobile app, there is a little calendar icon when you first log in on that kind of the home screen of the app once you've logged in. And when you click on that, it shows all of the previous like successful shifts that have been submitted or completed that have a successful clock in and clock out. So it just keeps a record of all the previous shifts that attendant has worked. And so it was just a feature that we had not called out specifically in our materials up to now, and have included that. So you can find that updated version of the EVV mobile app user guide on our website under the EVV resources. That's it.
Okay, thank you, Victoria. So real quickly, Rebecca, I believe it was Rebecca, number 4, are you with us? Anything that you might want to say that you hadn't covered already as far as accomplishments? PPL?
Yeah. Yes, can you hear me?
Yes, and we have about 1 minute at this point. You are going to have another chance
1 minute
to speak. We wrap up, but
yeah, that's okay. I don't have much. We did all our announcements. Just wanted to read out the EVV help desk number, which is 1-833-204-9041. Again, it's 1-833-204-9041. Feel free to call us if you have any issues with time for care. Thank you.
okay. Thank you, Rebecca. So finally, number 5, what improvements are planned? Jessica, we'll start with you.
Yeah, so I think at this point, we will just continue to field feedback that we get and look for ways to make providing feedback easy and accessible to individuals. We'll continue to review the data that we have access to make sure that where there needs to be improvements, we're able to work on those.
His urine was.
Oh, Robin. Oh, thanks so much. And continue having this conversation in PDPPC as it remains to be helpful to people. Thank you.
Thank you. Okay, so I will go to Palco, Victoria, and I do have to, we're running to the end of this time, so a couple of minutes would be great.
Okay,
Go
yeah,
ahead.
no problem. So I think similar to what Jessica mentioned, we're always looking for feedback. We welcome that, and we will pursue any issues that we need to as they come in. So as folks are sending feedback into us or to the department that gets passed along to us, we will continue to research that and to engage Fiserv, who's the vendor that manages the Authenticare app. So we will continue to kind of use that chain of communication to look into things as people make them known to us. And I think the other thing is just to reiterate that we will have sort of the bug fix, like Rebecca was mentioning, with the future dated timesheets. We'll have that in place pretty soon. I don't have an exact ETA on it, but we'll let the department know, and I can let this group know too in our next meeting if it looks like it's coming out pretty soon. That's it.
Okay, thank you so much. So we are moving to Rebecca with PPL. Have about 2 minutes, Rebecca.
Sounds good. I don't need 2 minutes, only a few seconds. So I just wanted to say that, yes, we're also continuing to take feedback from people, always open to hearing about ways we can improve the app and that functionality for folks. Anything that goes through our EVV help desk, we'll troubleshoot it, and then we'll escalate it to our developers to look at, to try to fix and release in an app update if there's issues. Obviously, if there's a time sensitive issue, we will escalate that. So yeah, always willing to work with folks, take feedback, and apply it as well. So thank you.
Great, thank you, Rebecca and Victoria and Jessica. Thank you. It is now 2:27. We're a couple minutes late moving into the break. We will resume the meeting at 2:38 and move into the break rooms. So see you all in 10 minutes. Thank you.